Hello, how are you doing, Dr. Schrott? Welcome.
Yes, welcome. Thank you. I'm doing well, and I hope you are also doing well, because the most important thing for us who practice Ayurveda is the well-being of the patient, because we do not really treat a disease, we do not really treat a cancer, we treat always the person, a human being, a patient in his totality. That means also including the environment, the family structure, the background, the profession, the physical health, the mental health, the consciousness, all these qualities. It's a package. It's a human being. It's the completeness we want to treat. And we do not focus primarily on the cancer. Of course, we give some additive, we're helping. If far as possible, we try to reduce side effects of modern medicine, if it's possible. But the main focus is always the person, the patient, not a specific disease selectively.
Yeah, that's true. Very true. Sometimes we actually self-tag ourselves, isn't like labeling ourselves as I'm a cancer patient, and then we sort of narrow ourselves into this boxing. You're right. Yeah, it's important.
I think this is a very important expression. You said labeling, because labeling is putting a program of self-sufficiency. You can program people that they get sick, but also can program to some extent that people become more healthy, become a better immunity, better immune system. And this is well established in modern medicine and scientific researches. So we should be very careful with labeling, and we have always a person in front of us whom we should reserve, we should have respect for this person and patient, because the patients, especially when it's a severe disease, the patients, they suffer sometimes from fear, from anxiety, from mental problems. And we have to take account this as much as possible, because there's such an important factor, especially in cancer patients.
Yeah, definitely. Well, that was a very good introduction. It speaks of it, you, you introducing yourself and the why I wanted you to be in this channel and your participation on it. We are with Dr. Ernst Schrott. He is based in Germany, I believe, not so far from Munich. So what is the area?
Yeah. Yes.
And well, basically the way we met, it was thanks to this Ayurvedic training course we are doing, being ongoing from last May on, 2020, sorry. And still going, but Dr. Schrott was one of our favorite teachers. I probably shouldn't be saying this, but it's true. We really enjoy your classes because we felt that you were really human, as you showed before. You're really tackling or considering the patient as a whole. And there's a lot of sensitiveness in your approach. I felt that even sometimes you mention things about playing the guitar or instruments, and you obviously, I can't imagine you play guitar. I don't know why I always had this feeling. You're a musician, because you do project that feeling, this humanness into your approach in medicine. So I would like you to just briefly introduce yourself. How is it that you have your own clinic, how do you start into this healing people, into this trade of helping and medicine, etc.?
Yes, thank you. I'm normally Western trained doctor with a normal study and everything what a Western doctor has to know, and have to be in the clinic and have learned a lot of this modern science and modern Western medicine. But I'm also trained in natural medicines like acupuncture, homeopathy, and especially, of course, in Ayurveda, Maharishi Ayurveda. And especially the last one has given me such a beautiful overview of life itself and how to approach a patient and see the holistic background of a person. What is the root of a disease? The root of a disease can be very subtle, which is not realized or recognized. Normally, you can feel it in the pulse, you can hear it when you have a complete history, when you see the patient, when you listen to him from the voice, so many aspects. And this, for me, is the most important, to have a holistic approach, So, and I'm very grateful that I was able to learn the Ayurvedic medicine from our beautiful and great teachers from the past 30 or 40 years even. And this is my daily practice. So it's a combination of Western medicine with all the diagnostic tools we have, and also with the understanding of these different medicines we can use in Western medicines, even like in cancer therapy, but also the other approaches which give us possibilities to support and to support the treatment of Western medicine, or even to replace it in some diseases. So it's the attempt to make the treatment as possible useful for the patient from many aspects. And as you know, of course, we have in Ayurveda not only medicines, Ayurvedic preparations, we have a complete number of tools, different approaches, which can be used for different purposes in different diseases, in different patients also. So this is very helpful. Like you mentioned, music. Music is sometimes really powerful because it makes a good mood. It brings it brings that vibrations and that melody into the system, which is many, many times necessary for the cure of a patient or the improvement of the situation, of the health situation of a patient. And it is really like that I sometimes recommend to patients that they should play music, that they should sing, or even one note playing on a guitar. That can be so nice, just to sit and forget everything and play this beautiful melody, a few tones. So for me, this is all treatment. This is all support of a patient.
Mm-hmm. That's very beautiful. That I think that's why we had this great admiration, because it's really looking at the person in a more integrative way, and the healing as an integration of different aspects. So I would like to share briefly, if you're okay with this, Dr. Schrott, just my last updates on my own journey and my healing. I had, in the last entry, mentioned that I had the mastectomy done. That was done on the 3rd of June. And it was one side only, on the left side. So it wasn't bilateral, but still it's quite invasive, as you know. Then I had a checkup with the surgeon. My last checkup was about a week after or something. I forgot the dates, but basically she gave me more news. Every time I go to the surgeon, I'm shaking because she always gives me something, she shares something that I wasn't expected. So we knew, thank God, that the biopsy of the tissue came back clear. So that was good, that was the first checkup after the surgery. She gave us those good news. But then the following, she gave me some not good news. And basically, she said that it would be recommended to have radiotherapy as well on top of all the procedures that I already had, which normally is chemotherapy. And I'm still ongoing with some injections. It's a form of chemo injected. It's called Herceptin. So I have to keep going with this one till December. And I had a big chemo, 6 sessions of the big chemo, and then the mastectomy. So I was thinking to myself, I never really liked the idea of doing the 3 things. I felt it was too much. That's my gut feeling. And when he said the reason for this radiotherapy in your case is because I immediately said, I think I'm gonna decline that one, this time. And she went, I know where you're coming from, but unfortunately, the fact that I had a biopsy of the sentinel nodes, the axillary nodes, previous to the major surgery, and she said, out of the 3, 2 were treated by the chemo, means they are clear now, but they had cancer cells. And then the 3rd one was clear all the time. So she said that was the reason that the team considers that it would be a good idea to have a few cycles of radio. And this is been a battle for me, I have to be honest, since I started with the diagnosis, because it's always trying to conciliate what is really necessary, what is not, to have this inner wisdom to choose and to pick when is enough. basically. And I reached that moment. I felt that, okay, already managed pretty okay. Thank God the chemo, thanks to Ayurveda and your advices in the group was crucial, the course that we were doing was really, really helpful and gave me so many tools to go through this. But at this point, I just feel nearly a bit rebellious, kind of like say, I'm not going to do it. And yet I have an appointment next week with a radiologist. I say, I'm not going to close my shutters like that. I'm going to talk to him and see what they can say or what they have to say. But 80% of my mind is done on the no, So that's one thing that I was a bit shocked. And then the other is I was noticing the pin of a needle on my reconstructed breast, and it's kind of like itchy or slightly painful with the clothing and that. So I pointed out to the surgeon and say, look, I'm noticing this here, even put her finger in there. And she went very nonchalantly, yeah, I know what it is. It's a staple. And I'm like, what? I say, a metal? And, I've been battling as well with using the breast implants because I didn't want it to have anything alien in my body anymore. And so obviously for me, it was kind of like a contradiction, It's like, I was thinking, she knew I didn't want it to have implants. And I was considering other ways of reconstruction, with autologous tissue. And yet she went and put this staple. She said, yeah, I had to do something. It was a blood vessel. Then I have to fix this way. It could be used in a stitch, but it's a procedure we do. And I'm like, is it going to be taken away? No, they're going to stay. Just forget about it. So I have a staple in my breast, and I don't know if it's, I remember one of your classes, you were saying the impact of metals and things like that. And again, I don't want to be all worried about this staple because it's chirurgical, it's supposed to be good for the body, but it's something that doesn't leave me 100% comfortable with, It's something that I don't know, it's in the back of my mind, so a bit worrisome there. So that's pretty much where I am at the moment. I mean, in general, I feel very blessed that they could preserve, say, my nipple and areola. I have a feeling of I still have a breast. The reconstruction wasn't too dramatic as I thought it was going to be, and I'm recovering fine. But it is always this aspect, as you say, the emotional impact of all of this, the worrisome on future recurrences. That's something that I'm dealing with also, because I've been having a lot of pain on my right ovary. And I don't really know where is this coming from. I actually went a week and a half ago to emergencies because I kept saying, my doctors, I have this pain. This is ongoing like 2 months. And they put an order for an ultrasound, but I haven't been seen, So I went for emergencies. I say, I really need to clear out what is happening there. Why do I have this pain? And so basically they told me I do have an ovary cyst, seemingly. And I'm thinking, oh my God, no, no more, because obviously I just passed something very major and thinking, okay, it's gone, or it's over, but it's still the health issues still kind of going. So I am going to check more, I'm going to check further because this was only a provisional ultrasound. They have these kind of portable ultrasounds, and the doctor warned me. She said, they're not the most accurate. We can have an idea, but we want you to really be seen by the specialist, for the ultrasound department and a gynecologist. So I'm on the process of doing that. I will see another doctor, hopefully soon. And that's basically the area where I've been a bit concerned about, again, it is all related. I'm aware that it's all obviously ovarian, anything that has to do with the sexual region and the breast. It's all, I think there is a link, even an emotional point of view, my own, as you said before, history, isn't it, with not having kids, for instance, or different situations that I've been through. How do we have to address those things as well to tap into, okay, how to go to the root of the problem? How can I treat this? What do I need to do, right? it's a tricky one. It's always a
Well, tricky one means it's tricky in you. It means it feels for you, it feels tricky, isn't it?
mm,
It is your vision. It's your how you see it.
yeah.
We have to be clear about that.
Yes.
Because maybe for the surgeon who wants to take out or not take out, it doesn't look tricky. Because he has the experience, he's maybe an experienced doctor, and he said it's okay, for him it's okay. So then we only have to think, is it really a problem from our view, from Ayurveda, maybe for you, because you feel not comfortable with it, it's worrying you. So we have to see this situation. And the same is also with the radiotherapy and the chemotherapy and these things. No, I can't interfere into that situation because you're not my case and I have no contact to your doctors. So it's always like that. First, they tell their experience from their personal experience from treating patients. And secondary, they have the statistics.
Yeah.
And here with the statistics, what I give my advice to the patients is when they're worried maybe about radiotherapy, they should ask the doctor, how much percentage is it improving if I do the survival rate or the improvement? How many percentage is it? Tell me the number.
Yes.
So let me give an example. If it's only 3%,
yeah.
then of course you could decide, okay, that's not so much. Then you can say, because of that 3%, I can't decide to do it. You can decide, but maybe you cannot. If it's 50%, then it's a lot, of course. And then the next step would be, okay, then it seems somehow there's a reason behind. And then let's think about what can we do to protect your body. What can we do from Ayurveda? Take substances like Ayurveda, like Amrit Kalash. What can we do with Marma therapy afterwards? What else can we do? And to reduce a little the fear is the modern radiotherapy is much more advanced and very, very specific. It's not like it was in the very past. I don't know how it will be with you, but I think it's the same. And from my experience, I just tell this, I do not recommend it or not recommend it. I just tell you to take a little away your fears.
Yeah.
I have a number of patients, ladies, who had the mastectomy, and afterwards they got the chemotherapy and the radiotherapy, and afterwards everything was fine. They got the reconstruction of the breast and they're completely healthy. They don't have any problems. Everything is fine. And even on the skin, you don't see anything. So it always depends how many of these numbers you get of radiotherapy and all
sessions. Yeah.
Yes. So it's not always like that. You know, it can be quite positive and it can be life-saving. And then with the additives and the support of natural medicine like Ayurveda, we can do a lot. But it's not like I recommend to do this. I just give you more perspective and try to take away your fear. And what you have to do, and this is my recommendation to all my patients, is you have to find your own sovereignty. You decide, but the sovereignty has to be on the basis of knowledge. Because if you only think, I don't want this is maybe it's your sovereignty, but it may have a wrong basis. You have to do it on good knowledge, and the good knowledge is coming from experienced, usually from experienced doctors, and from doctors whom you can trust. And sometimes like that, you ask your doctors or one of them, and you're not satisfied. Then you should ask another one. A second opinion, what we call it like that. You ask another one, and then if it comes to the same result, then it gives you more confidence in this direction or that direction. So it's very important that your decisions are based on a very clear vision. I go or I don't go. This is the most important for you. So try to get good knowledge. Don't try to get it from internet, because there you're completely confused. Internet is never individual. You know, it's always for everyone and no one. So good doctors will explain you honestly how it should be. And the last question is also, sometimes it's good to ask the doctor, what would you do in my situation? especially if it's a lady doctor, what would you do in my situation? Please give me an honest answer. I will not follow this necessarily, but just tell me. And this puts the doctor in the position of your position.
My surgeon,
you know, that makes a big difference, because then it becomes individual. You know, these statistics, they are overall and general. They are not taking into account an individual person, because one treatment may be for 95% of the community of the statistics perfect or not good, but for 5% or even 1% or an individual, it might be the correct one and the good one. So statistics are not always good when we point on an individual. I think you understand what I mean.
Yes, I know what you mean. That's a,
This is what I recommend very, very strong. This should be, and you should be very clear what you do. You should feel comfortable, and then finally listen to your heart in connection with the information you've got, the serious information, and then listen to your heart, what your heart is saying, and then make your conclusion and make the decision. Then you decide. You see, this is the best the advice I can give to you.
Thank you. You're right.
Nothing is wrong there. It can always, you can decide what you want, because it's your body.
Yeah, and there are always the side effects, and as you say, you have to kind of weigh, are they more predominant, the good points or the possibilities of healing fully, etc., no recurrency, etc., than the side effects, you know, because I've been reading different articles, and they obviously, if they're targeting the breast, once a woman has already an implant, it can cause a lot of problems, contracture, you know, capsular contracture and bar scarring and different things. Also, I read in another article that if it's just targeting the area of the axillary area, which is what it will be my case, it can cause lymphedema, you know. And so there are always the other side that you kind of like have to.
This is now the situation of what I wanted to take away from you, because you have the information from internet, and this is just general information about everything and nothing. You have to ask, in your situation, the doctor who is experienced and whom you trust, what he says about. If he says, in your case, I don't think this will be like that. No doctor can promise anything. This is a law, of course, but you can hear from his heart and mind when he says, in your case, I don't think this will happen. We have so much experience, then it's okay. If he says, well, now the situation is really like that, it's likely that it can come, then it's also like that. But likely doesn't mean it's really coming. Because in that situation, if it has to be, and it seems to be likely, we can try to interfere or to support the body and to maybe prevent these side effects that are said likely to come.
Yeah, very true. So you say that you've been treating women, or, well, in general, people with cancer. And so obviously, I remember in one of the classes, you say that it's very important that as consultants, we never will obviously interfere as you're doing it now. You're showing it in practice, say, don't take this or don't do that. It's kind of like trying to work hand in hand with what is there. And one of my consultations was actually in relation to Amrit Kalash that I have it here. It's a beautiful product. It looks like a product placement as an advertising now for Maharishi, but I just wanted to address this because it's quite powerful. It's a very powerful.
That's true. This is what's called in the ancient texts, in the Ayurvedic texts, thousands of years it was well known, and the composition is written there with all the herbs. I think it's 60 herbs, and also on the basis on the amla fruit and many other fruits or other ingredients are there. No, it's called Brahmakrita, but then the modern name here, especially in the West, it's called Amrit Kalash, and Amrit Kalash is like a marmalade. This one you had in the hand. It's a leham, what we call a leham. It's like a marmalade with all the ingredients. On the main ingredient is this fruit, amla fruit. but also the other ingredients. And you can take it with a spoon, like a normal. Okay.
Yeah.
And the normal dosage is twice a day, one teaspoon. Best would be to take it along with a sip of milk or some herbal tea or so. Now, it has a number of good effects. It's from scientific research. It seems to be the best free radical scavenger. It's neutralizing. It's really seems to be the best. There's a lot of comparison to vitamin C and E and other herbs, but it's tremendously taking away the free radicals. And this is very important for a different number of diseases, especially now when it comes to cancer, because in the cancer treatment, especially with the chemotherapy, of course, you create a high number of free radicals, and these also create side effects. They weaken the immunity and create an imbalance, of course, in the body. And this is one of the really good medicines to take away or to prevent as far as possible the side effects of chemotherapy and also from radiotherapy. And now there was one research, I think 10 or 15 years ago in India, and they had tested this prep on patients during the cancer treatment with chemotherapy, and it was very obvious that it's protecting the side effects as much as possible. And this has become also my experience, and really I can confirm those patients who take it, they have almost no side effects, or they have very little, not much. So they're very happy. And it gives them also strength, vitality. It protects the own immunity, and it makes probably, it looks like that, the cancer cells more sensitive to the chemotherapy. So the chemotherapy is not attacking the healthy cells so much because they're protected, and it makes them more sensible to the chemotherapy, this amricolage. So this is the one formula as a paste, as a leham. And then we have
the pills as well. Yeah, I have them here. Yeah,
yes,
the tablets.
This is the M5, is it?
Yeah, MA5.
Okay. Then this is tablets. The tablets are more on the mental level effective. They're also good for that, but they don't have that power, from my experience, than the leham. And there's a third preparation, which is sugar-free, is more for diabetic patients.
Yeah.
But this can be combined. The M5, it's called M5, and the MA4, the amricolage, can be combined. So 1 or 2 tablets twice a day, and then 1 teaspoon twice a day, or 3 teaspoons twice a day from the leham. This is one of the basic recommendations I give all to my cancer patients when chemotherapy or radiotherapy or whatever is to be done there.
Okay, so it's also useful for during radiotherapy, because if I do decide to go along with it, it's going to be for at least 3 weeks. I think there are 15 sessions. Yeah, from Monday to Friday, 3 weeks. So it's an ongoing process. It's quite long.
Yeah, you can continuously take it.
You continue, with the amricolage. No, for me, I can give a testimony on that. It helped me so much. I feel much stronger, and in relation to COVID and everything, some friends are asking me, are you scared, because you're more probably vulnerable after the chemo, and I actually feel it in my heart, and I say like that, I'm stronger than ever. I feel stronger than ever, and I think it has a lot to do with the nutrition in general, but the amricolage definitely.
Yeah, you mentioned COVID. I have also patients with this longer standing post-COVID symptoms like tiredness and all this. And when I gave them this amricolage, much better, because they got the energy and recovered more fast than if they wouldn't have taken it.
Oh, wow.
So it's really an overall good.
Yeah.
We shouldn't call it a medicine, because it's not a medicine in that sense of the Western understanding. It's a rasayana.
Tonic.
And rasayana is simply a health promoting herbal preparation, and everyone could take it, if healthy or not. It's health promoting. It supports the health. It's not specific against the disease. So this is important to mention.
Yeah, and that has to do, I think this product really summarizes the whole ethos of Ayurveda, isn't it? In a way, it's like it's like promoting from the basis of overall wellness. So preventing this, the illness like that, you know, if you reinforce the immune system, that's the best shield against any other possible illness or situation. Yeah. So yeah, I like it.
Yeah, and there is also a most important aspect, which is normally not so much seen. This is the self-healing power of everyone, the doctor in oneself. We're talking about the three doshas, Vata, Pitta, and Kapha, this balancing system in the environment, in nature, and which is also the basis of all the activities, mental and physical activities in our system. When Vata, Pitta, and Kapha, these elementary principles, when they're in balance, then we live in perfect health and happiness and radiance, and everything is fine, and normal immunity. And now the one approach is, if this is out of balance, now the one thing is we want to hold up, we want to keep this balance, which means prevention. So early enough, we can see if there is some imbalance in the patients, we can feel it, or in normal people, we can feel it in the pulse, or there's some symptoms. And if we start to balance that system early enough, then the diseases will not come. But if the disease has come already, then of course we have these different approaches in Ayurveda. And this is from outside, what a doctor can do for you. That the same doctor is in you, that the body's intelligence, that the innermost doctor, the natural ability to recover and to normalize as much as possible, is 24 hours a day active. Mm-hmm. And this doctor works on the same way. It wants to balance the three doshas, this Vata, Pitta, and Kapha. It's the same principle. So when you start to come out of balance, too much Vata means too much stress, too much nervousness, sleep disorders, anxiety, fear, etc. Then you start to get some desires to balance it. Or with Pitta, too much heat and inflammations, or with Kapha, too much heaviness, depression. So what we have to learn, and this is also a recommendation to my patients, whatever disease they have, we have to learn to trust this inner information system, this inner intelligence. That means we have to listen what the body is telling me. Mm-hmm. So what does he tell me? And then follow that, because people don't so much ask their own system, they always ask internet, you know?
Yeah.
But this is a common mistake. It's really a mistake. Maybe it's good to get some information, but it has nothing to do with you, because you are the one who has individual desires and that inspiration what to do, and the information is coming from you. Because body's intelligence is invincible, finally, if you follow that, because it's the same power which is working in the outside, in the environment, in the nature itself. It's the same nature. It's the same nature as outside is inside. And this inside nature is always tries to help you. It's always 24 hours helping you. And you have to learn to listen to this nature and get some information here and there and follow that. And if it's not so clear, then we have our specialists in Ayurveda or natural medicine, or also normal doctors. What means normal? Western trained doctors. Of course, they have also their experiences. And if they're good doctors, and of course there are many of them are good doctors, then they will support you and say, yeah, do this, if that, then follow that. So I just wanted to mention that, to make it clear that everything is also inside.
Yeah. It's also empowering. Instead of being scary, it becomes like a source of, I can do something. There's an agency here. There's something that I can interact in this process, you know? And like personally, for me, this journey is being about that, recovering my own sense of what can I do to fix this? You know, it's my own, really, ultimately my responsibility.
And it becomes more and more important, because the tendency in society to leave people alone and make them dependent on what they have to do, what has to be done. You have to follow this, you have to do this. And it starts to become taking away the sovereignty of the people. And this is, I see, this is dangerous, because if you tell the people you don't know anything, you have to follow this, we know it better, you make them dependent. Yeah. And that cannot be the way on living on this earth, because The main aim of Ayurveda, and everyone, of course, is self-realization, to find yourself, to come to yourself, to detect your inner riches, your inner, what is the wisdom, and what you are in your completeness. You have to discover yourself. Everything is in us. Also, Ayurveda is in us. Ayurveda is not a knowledge of books. It is only what is written there, what they found in themselves. But we are Ayurveda. Everything is there. We are the encyclopedia of the complete knowledge of Ayurveda. We are the one. We are indeed we are the knowledge. So it's very important to understand this and read more than us. It doesn't mean that we only read there, because many times we know we also need some advice from this doctor and from that person, because we are not so completely reconnected to our innermost self, what we call Atma in Ayurveda.
It's like this supreme intelligence. Sorry?
No, I hope I could make it a little clear in that short session.
No, it is very clear. Yeah. It's tapping into our inner wisdom, really. Like, then again, yeah, we have to take a time to strengthen that, because it's not something that is just there, right? I mean, it is, but we have to retrain ourselves to access to this wisdom.
It's a good aspect. We have to take our time to find ourselves.
Yeah.
Because the world nowadays is so much outwards.
Yeah.
Always outwards, and they should be in balance also inward, because the kingdom of our being finally is inside us. It's there. It's not outside. It's inside, because there is that level of immortality in us, and this is the kingdom. This area of immortality. Outside, everything's mortal. It's coming, it's staying, it's going. It's
temporary,
moving. Everything is going, and finally, also this body is going. The only one who is not going is the one who stays constantly in that body, because from the view of Ayurveda, the one who is living in the body is the one who is immortal.
Yes, it's very profound, beautiful. I really like those ideas as well about this process of learning, another way of taking care of our health and well-being. It's quite deep, it's very spiritual and rich, and definitely we definitely have probably is a bit of a mission, from the moment I felt driven to do this, these little videos to share it with other people is a way of putting it out there, and it's important.
It's a mission. It is that what we call dharma in Ayurveda. Dharma, it's what you are born to do. Yeah. That's the mission. So the dharma is your constitution, which gives you the tools to fulfill your purpose, what you're born for. And this is what you feel you have to do this in that way and this way, and this is fulfilling one of your missions. It's great.
Yeah, it is definitely helping for this process. It's part of it. And I wanted to ask you, Dr. Schrott, about marma therapy, because I think it's one of your main expertise areas, and I really thinking about doing a course. Somebody said that there might be one in Mexico next year or something. So I'm keeping an eye. Is it you who's going to teach it in Mexico?
Yeah, no. We want to have it there, of course, but it depends of the COVID situation. If it still continues, probably will be a problem. But if it comes down and we can have the course, we're aiming to that. We want to have it again. Because the Latin America people in South America and also North America, and they really have such a good feeling for that, what we realized. And they have the desire to learn that, and they have their own, they're deep-rooted from the heart coming desire to get that knowledge.
Yeah. Could you explain briefly what is marma? What is marma therapy? With somebody who never heard of it and is new?
Mm-hmm. Well, marma is, there are different views. You can say marma is an ancient knowledge from Ayurveda. There's some secret there. It has to do with the vital points, with energy points. energy fields. It has to do with the small points, what are called in China the acupuncture points. This belongs also to the area of Marma, but I would like to say it in a different way. Marma is the connecting point between the immortal consciousness in us and the physical body, which is constantly changing. And if the marmas, these vital energy points, are reconnected or still in connection, or are an expression of this immortal part in us, the body is constantly in a good situation, because he's constantly in that balance of the underlying intelligence, which is always taking care of the physical structure and and wants to keep it in balance. To make it more practically, it is energy points, and everyone knows them because we are very familiar with these areas. We are full of marmas. Mm-hmm. So, and every day we give treatments to marmas, even if you don't know it. For example, if you're thinking and you're concentrating, then you give a tender massage on Shankar marma. We call Shankar marma. So this is an area here, and has to do with intelligence, with the thinking mind, the controlling mind, and or you have some movement here on the third eye marma, which we call the Stapani marma, and you have here the Talahridaya, the heart of the hand, Talahridaya, the heart of the hand marma, and we have the Kshipra marmas, and so many marmas. So in the classical description of Sushruta, which is one of the books where the marmas are described, Sushruta describes 107 points plus one, which is Atma, which is the underlying marma, the
consciousness
marma of all the other marmas. But in Chinese medicine, there are smaller points. There are maybe 350 smaller points, and in South India, there's the Siddha medicine. They have also 350 points. Now, this is not important. The most important thing is how we understand marma. So it is said in the classical books, marma is Chetana Nipanda. It connects the consciousness, Chetana, with the physical body. So without the marmas, the body would not exist, because the consciousness which manifests the physical structure is the basis of the marmas, and the marmas on the different places are controlling the functions of mind and body, and is constantly connecting. So if that consciousness area on the surface of the body is damaged or is in imbalance, then the controlling is not functioning perfectly, and then the physical problems or even mental problems and diseases are coming. And the treatment is my treatment, or our treatment, which I developed with my teacher, Dr. Raju from Hyderabad, is not pressing the marmas, is not hurting or injuring the marmas with needles or so. It's just
gentle touch.
It's a gentle touch.
Okay.
And the secret is to reconnect this marma with the Atma, to bring it to complete silence. And this is the technique which so beautifully works. And you had been participating, and everyone is so fascinated by this approach.
Yeah, I don't have much experience, but one of the doctors here in Ireland, Dr. Rajvinder, she recorded a couple of videos showing a few sequences of using marma points for maybe relaxing before to go to bed, if you have insomnia, things like that. And I just found it fascinating, because, and then I knew that you have a book on that. I'm going to find it soon. How to do yourself, to work on marma points yourself.
You do it anyway. You do it anyway. This is the thing.
Yeah.
You don't know that you do it. You touch your heart, and then you do marma treatment.
Yes.
In that moment, it is marma treatment. It's just a touch. Sometimes the touch is to protect. Sometimes it's to calm, sometimes it's to enliven, sometimes it's to support. And this is then it's natural. And only when it is natural, it's in tune with the nature, and then it's completely healthy and balancing and doesn't do harm.
Yeah.
Only. And you can see if the treatment is natural, it looks natural.
It feels right.
It looks like natural. It is that how the hands move, how you touch, how you do it. It's just a friendly approach, nothing else. And if you wouldn't say anything and someone is observing a treatment, this kind of treatment, which we call sukshma, tender, maybe he wouldn't even think it's a treatment because it looks so normal and natural. But this is the secret, because then it is overwhelming success. It's incredible in how short time things can balance. And the most important thing is we do not balance, we only create an environment, but nature itself is balancing. It's an inner healing process. The inner system, our body's intelligence, is normalizing. It's our inner nature. And we are only creating a situation that it is better, easily working. Most important, because we do not give energy, we do not manipulate, we do not want that this happens and that happens. This is not in our hand. It's working, it's happening by nature itself. And nature knows best how to do it.
So it's kind of creating the space and allowing, maybe leave the patient out of the way, so not to interfere, and allowing the nature to do its job, kind of thing.
Yeah, this is very important now, especially when you ask me what can we do for cancer patients. One of the more severe problems, of course, the cancer itself, but by the cancer and all the modern treatments, that may create the fear and some confusion and sleep disorders and so many conflicts and problems, which is weakening the system, which is weakening the immunity, which is a pathogenic factor itself. It's like a poison, how to say, a mental, psychic poison itself. And for this, we have to care that the patient gets the confidence, that it becomes calm. And one of the approaches is marma therapy. That can be quite simple, with a few words and with some touch here and there, some support for the heart, something for the mind, something calming from this adipati marma, something on the feet, whatever. There are a lot of protocols we have developed, and of course we can use the different points for the different problems. So this would be one approach, which may not last for hours. Sometimes it's only 3, 4, 5 minutes, only a few minutes, because it needs not too much. It just needs for the patient the experience, this is comforting me and gives me safety and confidence for the future, because the mind then gets focused on a solution and doesn't get lost in the world of problems where there doesn't seem to be a solution. So this is what I said in the beginning, is the most important way of how we should see a patient with a cancer. We do not aim to treat the cancer, we treat the patient, so that the inner intelligence of the patient can normalize the city, can support the other necessary treatment. So very, very important. And of course, we have other approaches like herbal medicines. We mentioned the Amrikalaj, but there is something for the liver protection when there is a side effect on the liver. We have medicines for some chemotherapies. They may damage the peripheral nerves so that the numbness is coming. We can do something protecting for that. So there are a lot of things we can support and help. And this is also working together what is necessary. It's just in the time where we live now, we have only the tools for the treatment of cancer, which are available and which are known. And normally in the cities and where we live, this is the modern medicine, how it is. And that's the way how it should be done and can be done. And then we have to live with it. And then we do the best for that, from our side, and they do their best from their side. Of course, there are better approaches somewhere, maybe in the jungle of somewhere, you know, in the Amazonas, which we don't know, or people went there. And sometimes the self-healing is simply taking place. I had one patient, she had also mastectomy, and she had metastasis in the bones, in the legs, and she had radiotherapy, and she was lying in the hospital here, in the local hospital. So she had time, she had a lot of time, and she was thinking, why do I have this cancer? Why do I have to have this? And all of a sudden she understood the background, why it had come, why it came. And then she decided immediately to stop this. And then the miracle happened. When she had made the decision, everything went away without any additional therapy. The only thing she practiced, because I recommended, was transcendental meditation, which gave her also more relaxation and recovery. But basically it was the decision, and everything, the metastasis went off, she recovered completely, and she was completely healthy.
Wow.
So I have a number of these kind, and
Cases.
it's always similar. I have another patient who had a thyroid cancer. And I was very young when I started treatment in the alternative medicine, complementary medicine. So I gave him some of these missile preparations, but I don't know if it really worked. I don't think so. He went off or kept off from my practice. But then 12 years later, he came again with his son, and I was very surprised because he was completely healthy. And I asked him, what did you do? And he said, the only thing I did, I was thinking about, why do I have this cancer here on the thyroid? I found the reason, I stopped the reason, and I got healthy. You know, there is also in the scientific literature, there's quite a number of cases of this spontaneous self-healing. But I think it's always something like that on the level of consciousness.
So something to do, is it something mostly to do with maybe a toxic relationship, or maybe working in something that you don't like, things like that?
It can be many things. It's not always like that. But on the other side, to be honest, it's because many times I discuss with my patients, do we have some reason for that? And then they may find some reason, and sometimes they can't change, but the cancer state. So it might have been not the real reason. I think in that person, it should be very clear. It should like falling from the eyes. Oh yes, completely, I understand, completely. There's no doubt about that. And then of course there's also no guarantee that it works, but in that case I had it worked, you know.
For me it's a mystery, because I feel that cancer is multifactorial, and it is very much linked to emotional blockage. I think that's my feeling, with things that weren't properly resolved in the past, or things that weren't dealt with in a proper manner. But it also had obviously the other aspects, you know, from the physical point of view, the contamination in the food, that's everything we know, radiation, you know, of the gadgets and etc. But it's definitely multifactorial, and it is interesting having to actually face that question. Is it like to review yourself? What do I think was the culprit, the main culprit, or the trigger, or which ones?
A very important question, which I often put to the patient. What do you think? If you knew anything, if you knew nothing, what is your opinion? And then a good answer is coming. But what you said is, there is one point you have to consider. You mentioned a number of possible influences that might have created that. It might be genetic influences, might be toxins outside the cell. The only question is why is that person getting the problem and other persons who have the same influence didn't get the disease? So these multiple influences, many people have it, and it doesn't help so much, from my opinion, only if there is really something heavy, what we really can, but there's the common sense would say, yes, it feels logic, you know, it feels like logic, and I think it feels that that's the problem. But I have to mention one important thing here, and that really has to be clear. Because when we talk in that way to patients, all of a sudden patient feels guilty because he thinks,
Yeah.
oh, I'm the one
Something
who's
wrong. Yeah, something wrong
I'm
with
the
me.
one. And if I don't find the reason, then I'm the guilty one, because that is not the meaning. Absolutely
Yeah.
not, because in many times you really don't know where it's coming from. And it's only one aspect one can consider, and it is more a support than making someone guilty, which is completely nonsense. It's just a possibility, and it's always positive, because if you change something in the life which you didn't like, why not to change it? With a disease, without a disease, who cares? You don't want it, then change it. So it's positive, and one should not be put in a position, if you don't change that, you will not be cured. That's completely nonsense, of course. And that's really important for me to make it clear. Everyone should be happy with this idea. There's maybe some possibility, but it's not necessarily the only way to cure.
Yeah.
If at all, maybe it's not at all. It's not at all maybe the approach, but sometimes it happens like that.
Yeah, thanks for sharing those experiences. So yeah, I think if you want to start maybe wrapping up, I really appreciate your time, because I know you're super busy. You're a really active doctor and doing courses, and I'm definitely gonna think about Marma therapy for if it goes ahead. In the future, I have it in my bucket list. Things that I see very important to learn, and but obviously we still have to finish with this course. We see when we can do the consultation part. With it's all hanging at the moment, but it's a beautiful world. It's definitely opening so many options on how to heal ourselves, how to heal others, how to just live a more fulfilling life in general. It's quite rich. Ayurveda is a really rich world to start exploring.
A lot of before we close the session, I really would give some recommendations what people in general can do. This belongs to all diseases, or no diseases even, but especially in cancer, it might be really helpful. And the one thing is meditation.
Yeah.
I don't know, are you practicing transcendental meditation or any other one?
I do, TM, yeah.
Okay, TM.
Mm-hmm.
I'm a fan of transcendental meditation because it's easy to learn. It doesn't take long time. It's 20 minutes twice a day. And it's available everywhere with good teachers, and it is scientifically so proven, so good, proved. So, and it is really something I could recommend to everyone, especially in cancer, because the people can come back to themselves, come deep into silence, can transcend, and then with a fresh mind and a clear vision and a positive vision, they can come out. And it makes it much easier to deal with this, problem in daily life.
TTs,
Nutrition and this dietary aspect is very important, because it should be regular, it should be fresh, good food. It should be, if possible, more into the direction of vegetarian. And the main meal should always be at lunchtime, because here our digestive fire is most active and digestion is much more easy. If the main meal is in the evening, which so many people have nowadays, it becomes much more difficult for our system to digest, and some side products, not completely digested food items, will stay there, and they have pathological effects on our system and weaken the system and also the immunity. Then behavior, that means one should go early to bed and should wake up early in the morning and have a morning walk if possible, if you're going to work. And so because the morning hours, they have a lot of power of rejuvenation, regeneration, very good for immunity, very good for optimism, very good for the health. So morning hours, at least at the weekend, can really useful.
First thing, as you wake up from bed, directly go for a walk. Okay.
Absolutely useful in the morning.
Yeah.
Then rasayanas, we mentioned some of them like amrikraj, and them specific one for protecting or supporting digestive system, aromatherapy. And then there are other approaches via the senses. For example, music therapy, beautiful Gandharva music, which is Vedic music, and a few melodies, a few minutes of this beautiful sounds with their instruments according to the daytime can be changed completely our physiology. You really feel how you can transcend, you come to silence after a few minutes listening. That can be done before going to bed. And these CDs are available everywhere. It's called the Maharishi Gandharva Veda. One can look it up on the internet. One can even listen to it on the internet.
Yeah.
Or buy the CDs, and it's really helpful. Aromatherapy, there's one aspect I really want to mention. You know, every cell has an own music and vibration and creates a healthy body, a healthy cell, healthy tissues create a good smell. You can smell the baby. If you have a healthy baby, it's such a nice smell. But diseases create a bad smell. This is an expression of misfunction and misfunction or dysfunction. I don't know.
Decay.
Decay of tissues, and that creates that foul smelling sometimes, or a smell of nervousness. And this is in the environment then. But when you apply some essential oils aromatherapy, then this is neutralizing, and it creates a much better situation in our system. And like with the music, it's the same with the smell, the sound and the smell. And Vedic sounds also, some aspects of that. And then there's the last point I want to mention is purification. Sometimes we have to do a light fasting, but this has to be according to the physical structure of the body and in what situation this is.
Yeah.
But some elimination, some really nice, friendly elimination, purification can be very useful.
Detoxing. Every now and again.
Detox.
Yeah.
And for example, drinking hot water, this very simple Ayurvedic procedure. You boil normal water 10 minutes, you keep it in a thermos, and then every half hours you drink a few sips all over the day. It's so nice and so easy and simple and purifying the system. And the same is when you have a herbal tea like a ginger tea or whatever. So these are very nice tools we can add to the improvement. We can add to our lifestyle, everyday lifestyle, to improve our health and balance the system. So
there are two.
if we take all this, some of the approaches, it might be very useful, especially in the severe cases of disease.
Yeah, very good. Good tips. Thank you so much, Dr. Schrott. Actually, we're on the time, but I was just thinking, I forgot to ask you this. Say, I have this pain I mentioned in the ovarian area. Do you think marma, can I apply subtle massaging in the area? Do you think it's a good idea? Because mom told me something. She said, when you have something, you shouldn't be massaging so much because it's just creating more tension in the area, so that...
Well, wherever there's a problem, you can give a marma treatment because it's natural, but it's not a massage. It's
intention.
The secret is the touch.
Okay.
You can use some essential oils for that, or a marma oils, and the way how you touch. And in my book, you will find the places, the marmas, which you can, to which you can give this kind of treatment. But it should be normal, what you naturally anyway would do.
Okay.
If there is a problem in the ovaries, you might have a tendency to put your flat hands there to give some protection, some warmth there, some comfort. Maybe some good things are happening there. And that can be done everywhere. And for example, in the case of cancer, it's many times that we do not have to treat directly on the place of the cancer, we treat the heart. Because there is the immunity, the main place of immunity. So we are treating the heart, marma, and give the support on the brihati marma.
On the
And
back.
some other marmers which are balancing the mind and give the confidence and bring the calmness in the mind. So this is what I wanted to say at the beginning. This is treating the patient, not so much the disease itself.
Yeah, not just focus on that organ or that area, but
yes.
Yeah.
And in the ovary, because this is in the pelvis, and in the pelvis are the organs of elimination, and also this mental aspect of let go is rooted there in the marmas. So when you read in the marma book, then you will find this expression of apana vata, and there are some marmas which have a connection to this apana vata, that means the elimination principle and let go principles. And if you treat this, then it might be more effect if you only treat directly the ovaries. So there's the underlying principles are much more effective than the direct disease locally. If you treat it.
Very interesting. I got it. I got you. You really, really beautiful talk. I appreciate so much your time and your expertise. And so we keep in touch. Definitely, I will enjoy your classes, and I hopefully, in Mexico will be great to share space, to get to know you, to meet you, and see.
Thank you.
In action teaching.
It was a lot of fun to talk to you, to speak with you. You have a brilliant mind, you have a warm heart, and you are sunshine.
Oh,
so everything will be fine. Finally, everything will be fine. You follow your heart, and just what everything I said to you, it will give you a good basis, and nature will support you. Everything will be best for you. So take care.
Thank you so much. All the best to you too. Enjoy your summer. Bye.
Bye-bye.